Hi everyone, welcome to How to Have the Best Festival Experience presented by Wolverine Wellness. My name is Emily. I am one of the health educators with Wolverine Wellness, and I'm really excited to talk to you today about music festivals this summer or just any time in the future, and how you can be best prepared. So of course, people attend festivals for many different reasons, including the music. Sometimes festivals focus a lot on food with chefs coming in from all over the place. A lot of these events also focus on community building, and some people just like to travel as well because it's summertime and they have that opportunity. So we just want to acknowledge that people attend these events for many different reasons outside of drugs and alcohol, which we are going to be focusing on today, as well as general safety. So first, we'll just be going over general information, water, sun, and communication tips. Then we'll be talking about alcohol and other drugs, talking about some strategies that you can use. And then we will finish up with how to be prepared in case you encounter someone who might be having an overdose or need information or need naloxone. So events are quickly approaching. If you're a U of M student, it's almost summer break. And since people are vaccinated and are more comfortable with socializing, there are even more festivals planned for this summer than there have been in a couple of years. So either you have been to a music festival before and haven't been in 2 years, or you've never been to one and this will be your first year attending. There are a lot of different emotions circulating right now about COVID and the pandemic. Some people are still using a lot of different precautions. Some people are a little bit more relaxed. So if you're traveling far away to go to a festival or you're traveling locally, remember to still use caution when attending festivals. So using masks, respecting people who use masks or choose not to use masks, and getting tested before and after your trip. This is just a couple of examples of festivals that are coming up all over the country in the next couple of months. And in warmer states like California and Las Vegas, they often extend farther into the fall as well. So this webinar, we really want you to think about how you want to plan ahead for your festival. Of course, festivals are really exciting and there's a lot of different things to consider when you're planning your day or your weekend. We really encourage you to set expectations with your group beforehand. A little bit more about that coming up soon. But just remembering that good communication is key and talking with your group about how to be best prepared, who's bringing what, and understanding ultimately what experience you want to have at the festival. So first, we'll be talking about just general information and safety. First thing is location, location, location. Locations are really, really important when entering a festival. So number one thing that you're going to want to find is the first aid tent. Find out what services are provided and how to get help quickly if you need it, if you're not near the first aid tent. What color vests do medical workers wear so that you're able to spot them easily in a crowd if you need help or if someone you know needs help. Also finding bathrooms. Of course, it's good to know where a couple of different locations are in case one is not working or in use. And a water station or where to buy water because hydration is key. So if you can, utilizing a map before you enter or finding these locations the moment you enter and before you start enjoying your festival experience. Another important thing to do right when you enter the festival is to find a meeting spot that you will meet with at your group at a certain time of day, either multiple times throughout the day or at the end of the day. Also remember that there's little or no self-service typically in these festivals because there are so many people around, and a meeting spot will help you find each other if you aren't able to text or call. Additionally, turn on location services or Find My Friends, so that if you do have a couple of bars of service, you are able to find each other. And one extra tip is if you're having trouble sending a message, make sure you add a timestamp of when you added it. So if I was telling my friend that I was at the food stand, I would say I'm at the food stand, sent at 3:30 p.m. So if your friend gets that text at 4:30, they'll know that you're most likely not there anymore. So this is just a good way to make sure that everyone is aware of what's happening at all times. We also encourage you to stay in pairs throughout the festival, so that you always do have someone to walk with in case you do get separated from the rest of your group. Things to bring, a phone charger if you're able to, or find out where a charging station is. Portable phone chargers are really helpful. If you can buy one that you know will last through multiple charges in a day that you can share with your group, that's great as well. Water, check on the website before you go to the festival to see if you're allowed to bring in your own water, and electrolytes if you can, especially if you're going to be in a more desert area. Also, pro tip, leave your fancy hydro flask at home. Buy a plastic disposable water bottle that you won't care that if you lose it or not. Sunscreen, reapply throughout the day. That includes your face, your body, and your lips. Buy chapstick with sunscreen in it. It doesn't taste great, but it's better than having sunburned lips. In addition to that, more sun protection, hat and sunglasses just to keep yourself safe and a little bit cooler. Check again if your festival allows you to bring in snacks. Bring high protein things, Kind bars, just any type of granola bar, nuts, so that you can have snacks throughout the day and won't spend as much money on festival food. And then, of course, hand sanitizer. You don't want to worry if there isn't any soap left when you go to use the bathroom or before you're about to eat. So those are some ideas of things to bring. Of course, make your own checklist of things that you'll need specifically for the event you're going to, whether that be chairs, blankets, things like that. So always be prepared and coordinate with your group as well. So, of course, in the last year or so, there's been some unfortunate incidents involving crowds. And so we wanted to give you a couple of crowd safety tips. Number one thing is that if at any point you feel unsafe, leave the crowd. That is completely up to you, how you define feeling unsafe. But if at any moment that's how you feel, trust your instincts and intuition and leave. If you decide to leave the crowd and your friends still feel safe and don't want to, give them a landmark that you will be waiting for them at, so that they know that where to get you when they are finished watching the performance. Be really aware of the density of people ahead of you and behind you. So just being aware of facially at all times. And in order to feel out density, essentially, if you feel that people are touching you on both of your shoulders or just several places on your body at the same time, the density of the crowd is probably too high. So if you're able to, leave the crowd and get away to a place that has lower density. If you do sense danger, be sure to put your arms out in front of your chest so that your lungs can expand a couple of centimeters and give yourself space to breathe. So just brace your arms in front of your chest and make sure that you're able to breathe in and out comfortably. Finally, we want to encourage you to avoid pushing and instead move with the crowd and help others if you can. Altruism has been found to be really helpful in situations like this. So if you're trying to help other people will follow suit as well. And again, bottom line, if you feel unsafe, try and leave. Just a bonus tip, only have trusted friends take your group pictures. Do not give your phone or any other possessions to a stranger. There's always incidences of people's items and property being stolen at these festivals. So just make sure that you have everything really close to you at all times. All right, now we are going to talk about alcohol and other drugs. But before we do that, just a quick reminder that people attend music festivals for lots of different reasons, including music, friends, food, and art. Also remember that not everyone at festivals is drinking alcohol or consuming substances. Many people who go to these festivals are in recovery. And if you are one of those people, you can always look for the yellow balloons at a music festival for sober recovery resources and people. If you do choose to drink alcohol, definitely stay hydrated. Alcohol can dehydrate you, so be sure to alternate your drinks with water. And this is especially important if you are attending a festival that is in a really hot place like the desert. Remember to space out your drinks as well. So if it normally takes you 20 minutes to finish a drink, try taking 40 minutes instead. And in addition to that, set limits on your drinks before you enter the festival, so you know exactly how many you're going to drink that day. And remember to eat immediately before and while drinking, especially foods high in protein and or fat. If you choose to consume cannabis, keep these things in mind. Remember to go slow, and that you can always take more cannabis, but you can't take less of it. Pick and choose if you're going to use, try to use lower potency products under 10% THC, and avoid high frequency use. So set a limit before you enter the festival, smoking or consuming cannabis one time during the day instead of multiple times throughout the day. Other drugs. Music festival culture often includes drug use, but many people, again, abstain from using for many different reasons, including disinterest, recovery, and more. So keeping that in mind, if you are wondering if everyone at these festivals is using drugs. But if you or someone you know does choose to use, here are a couple of tips for things as well. And this applies to all alcohol and other drugs, but we definitely want to encourage you to designate a sober friend, one friend for your group every day, so that this person can get help if needed and watch out for the group. Again, buddy up, do not walk around alone. We encourage you to stay in your group as much as possible. Bring your own. Do not buy anything or take anything from a stranger. Know your source, know what you're consuming, only from yourself that you brought, things that you brought, or from people in your group that you brought as well. In addition to that, if you can, find out if your festival is going to have a testing kit to test for fentanyl, or bring your own testing kit or test prior to attending the festival. And now I will turn it over to Miranda Galley, MPH MSW, who is a former trainer with Project Action with Dr. Gina Dahlem, which is a project that educates the public on naloxone and opioid overdose reversal. And she will be talking to us about fentanyl, overdoses, and naloxone. So I'll hand it over to Miranda.
Thanks, Emily. Hi, folks. I'm excited to talk to you about testing and naloxone. So as Emily mentioned, testing your drugs before consuming is really important, because something we know nowadays is that a lot of drugs are often cut with and or contaminated by fentanyl. So what is fentanyl? Fentanyl is a synthetic opioid that is very strong. Often it's used for pain management and cancer treatment. And so a very small amount is good for a large amount of pain relief. But what is now happening is it's being found in other forms of drugs, including other opioids like heroin, but also things like cocaine, counterfeit Xanax, and ecstasy, which can be present in a music festival. And we want to talk about fentanyl because even a small amount of fentanyl can cause an overdose. And it is important to be aware of fentanyl when you're thinking about consuming drugs. Something important to note is that most overdose deaths in the state of Michigan are actually coming from synthetic drugs such as fentanyl. And fentanyl onset usually occurs within 5 to 30 minutes, but lasts 1 to 3 hours. You can go to the next slide, please, Emily. So something that's important to note when we're considering things like fentanyl is the signs of overdose. It can be important if a friend you're with or a member of a group or even an individual near you at a festival falls into any of these signs to kind of be aware of what they are so you can get help if needed. So typically the signs of overdose include loss of consciousness. They may be unresponsive to outside stimulants such as talking or shaking the person. They might be awake or seem awake but be unable to talk. Often their breathing is very slow and shallow, and it can be erratic or completely stop. For individuals who have a lighter skin tone, their skin will often turn bluish, especially around the lip area, or purple. And then for individuals who are darker skinned, they might turn a little bit grayish or ashen. Another sign of overdose can be choking sounds or a snore like gurgling. Occasionally, this is referred to as a death rattle. Vomiting can also be a side effect, body going limp, face getting pale and clammy. Fingernails also a really good spot to check if they're turning blue or purplish and black. And finally, if the pulse or heartbeat is slow or not there at all. And generally, when it comes to an opiate overdose, the main issue is lack of oxygenation. So there's having trouble breathing, and we're seeing a cascade of signs that come from that. You can go to the next slide, Emily. So there's three really major signs that we encourage you to look for. The last list is really comprehensive and can definitely encompass everything you might see. But these are three really good signs if you're in the moment and you're thinking, okay, I'm not sure what's going on, but this is what I should mainly look for. So again, that very slow or very irregular breathing, that main cause of lack of oxygenation, can be really dangerous. So we want to make sure we know what's happening and checking for lung function. Purple, blue, gray, ashen lips or fingernails, and unresponsiveness to pain. So a really good tip if you're checking for responsiveness for an individual is to do a sternum rub. So an example I can give is you put your hand into a fist, and then you're going to rub right on that breastbone, right on that sternum. If you do it to yourself right now, you'll feel it kind of is uncomfortable, especially if you apply a lot of pressure. So if you're doing this to an individual who might have passed out, if they're not responsive to a breastbone rub, that's a really good sign they're unresponsive in general and you need to get help. Go to that next slide then, Emily. Okay, thank you. So we want to introduce you all to naloxone and how it can be a really important drug to have on hand when you are at a music festival. So naloxone, or you might have heard brand name Narcan, is a medication. It's a prescription that can be used to rapidly reverse an overdose. So it can cause a person to begin breathing again after they might have stopped. It really is effective, and it can be given to an individual through their nose or in a syringe through their skin and muscle. And it's important to administer Narcan when the person is experiencing an overdose. So something that is good to know about Narcan is it typically works within just a few minutes, and it'll roughly last 120 minutes. So Narcan can help immediately, and it can last for a little while you are getting help. Some other things to note is that it has a pretty good shelf life. So if you get some, you can keep it for quite a while, maybe put it in your travel kit if you know you're going to a music festival. Typically, when we store it, we want to protect it from light, and we do want to typically store it at room temperature. However, those things might not be possible at a music festival. So it's important for you to do these things while you have it at home. And then when you come to a music festival, maybe keep it in a fanny pack, keep it in your tent, but keep it somewhere accessible, even if it's going to be shown a bit of light or kept at a little bit of a higher temperature for a short amount of time. And you can go to the next slide, please. All right, so how do I use naloxone? One of the most important things about using naloxone is calling 911 first. So typically what I'll teach individuals when it comes to using naloxone and responding to an overdose is to go by the acronym ACTION. So the A would be for arousing that person, doing that sternum rub that we talked about. Then you want to check. The C in ACTION would be checking for signs of overdose, going over some of those things that we talked about before, specifically the lack of oxygenation, trouble breathing, skin that is blue, purple, ashen, and if that individual is unresponsive. And then we want to call 911. It is super important that you call 911 before administering naloxone because emergency services is critical for when naloxone is being just used. And I'll go into that for a second. Then we want to give the naloxone to the individual. So typically you're going to find it in a nasal spray. That's the most common way that you find it. You'll want to take it out of the box. It kind of looks like a little T. And the number one thing I tell people is don't do a test spray. There's only the amount in the Narcan for one use. So if you test spray it, you're going to use and waste that dose. So you don't want to test it. Just make sure you tilt the person's head back, put the tip of the nozzle up their nose. And then at that point, once you have it situated in the individual's nose, then you want to push the plunger to administer the dose. Narcan typically works within about 5 minutes, and if the individual is not responding in about 2, you'll probably want to administer a second dose. It's very common with substances such as fentanyl because it is so powerful that individuals might need a second dose. So don't be afraid to use it if you think you need it. And finally, we want to put the individual in a recovery position, kind of like the one that's displayed, have their head propped up, have a knee supporting them, and keep them in a position that they'll be comfortable in. So as I mentioned, naloxone works pretty quickly and it will last 120 minutes. It's important that we keep that in mind when we're using naloxone because fentanyl in particular can last between 1 to 3 hours. That means you can use naloxone on an individual and they can actually fall back into overdose once the naloxone wears off if the fentanyl is still in their system. That's why it's super important to call 911 first, because we want to make sure emergency services are there to help the individual in case they fall back into overdose. Secondly, when an individual comes out of an overdose, when they're using naloxone, naloxone won't hurt the individual. It can only help them. It can only save their life. But it might also cause a couple of side effects. Often individuals might experience disorientation, they might feel nauseous, or they might vomit, or other individuals might become agitated after having naloxone administered to them. And that's another reason why we really want to call 911, is to make sure that you're not just the only one there handling those things, but a medical professional is there with you to help those individuals, especially if they're really disoriented or if they're vomiting or any of those things. So definitely make sure the first thing you do is call 911, and then don't do a test spray, just spray right into the individual's nose. All right, and you can go on to the next slide, Emily. And I'll turn it back over to Emily so she can tell you all where to get naloxone at University of Michigan.
Thanks, Miranda. That was really, really helpful. I think just understanding and knowing the steps is a great place to start. So if someone has naloxone and they've never used it, you can also assist them in the case of an emergency. So Wolverine Wellness currently has some naloxone available. If you have gone to get sleep kits or safer sex supplies from Wolverine Wellness, it's on that same little shelf outside the office. You do not have to come in and talk to any of us unless you have questions. We would love to talk to you if you do, but you're able to just take one package along with a instruction guide, and we will hopefully be getting more of those in the future. If we run out of naloxone, the Ann Arbor Public Library, the downtown branch, just put in a naloxone vending machine. They're free though, you do not have to pay for them. And And so you can go and get one from the public library, which is displayed in that upper picture and has the ACTION acronym that Miranda was mentioning. Unified in Ypsilanti, I listed the address here, also has naloxone for free, and many pharmacies also sell it over the counter with no prescription needed. But if you are unable to afford it, you can go to a doctor and get a prescription from them as well. So main takeaways for what we've talked about today: make a list, one for yourself, one for your group. And in addition to that, plan ahead, set expectations and boundaries and communication strategies with your group and your friends before the music festival. Understand that different people want different things out of music festivals, whether that be enjoying the music, food, community, and understanding that everyone has different boundaries when it comes to COVID as well. Remember to stay hydrated, drink water, also eat things high protein and fats in order to make it through a long day or a long weekend of a music festival. And finally, please get help if needed. If at any point you think something is wrong, get help, find the first aid tent. I know we said a couple of times to call 911 if you feel as though you need to distribute naloxone. That might not be possible at a music festival if it's a really large one and there isn't cell service. So a good tip is to designate someone. So actually point to someone, say, go get help, and have them run and go get an EMT or anyone else who is around that can assist you. So many of these guidelines are also applicable to other experiences, events, and substances that you might encounter throughout the summer or just in the future. So please keep these in mind while you're out navigating our post-vaccination world and going back and doing more experiences and fun things. If you have questions or believe that we missed anything critical, if you have experienced a lot of music festivals and have a tip that you think that is really, really vital that we missed, please send me an email at emilygio@umich.edu. If you're interested in going to a music festival, or you know you will be, but you're a little nervous about it and want to talk out your expectations and your plan with someone, you can sign up for wellness coaching to talk to one of us about that. Or if you're concerned about alcohol and other drugs, you can make an appointment for wellness coaching for that as well. Also remember our collegiate recovery program with Matt Statman. You can email him for more information. And this webinar, of course, will be available on the UHS website. And so please feel free to rewatch and get some information for planning your music festival experience for the summer. So thank you for watching. And again, if you have any questions, please let us know. Thank you so much.